joining millions of people around the globe commemorating World AIDS Day. 23 ABC's Faven Kay sat down with one local advocate who has survived the deadly disease for 30 years and is now making his mission now to save other lives.
Standing at 6'4" and a strong physical stature, it's hard to tell just by looking at Martin Sharp that he's living with HIV and has been for the past 30 years.
I had a partner that was HIV that came down with full-blown AIDS.
Born and raised in Bakersfield, Martin worked as a Bakersfield police officer and a sheriff's deputy. At 35 years old, Martin became infected during the height of the AIDS epidemic.
I've never had AIDS. I've been very fortunate to do all the right things, and everybody I knew in the AIDS community had full-blown AIDS. Everybody. There was nobody that was HIV positive except me.
Martin never imagined he'd live this long.
And I never thought I'd see 50 because at the time that I was diagnosed, it was a death sentence, and I just figured, okay, in about 10 years I'm going to get sick, and then I'm going to be dead in 3 to 5 years after that.
But in the 35 years that AIDS has been around, there's been tremendous strides in prevention education, awareness, and advancements in treatment. Dr. Franco Felizarta, a local HIV and infectious disease specialist, says these advancements have led to a significant decrease in HIV-related deaths.
Before, nationally, maybe about 50,000 patients will die every year because of HIV, up to 50,000. Now it's about, in 2014, the latest data, at least in 2014, was 7,000 patients per year.
But while we continue to see a decrease in the number of people dying, Kern County public health officials say more people under the age of 20 have been diagnosed with the deadly disease in the past 5 years than any other 5-year period.
So we're doing a great job in decreasing the mortality, but we're not doing a great job in decreasing the transmission.
But there's a new HIV prevention aimed at reducing the risk of becoming infected.
PrEP is very useful for anyone that is either in a partnership with someone that is currently HIV positive, or perhaps someone that is actively partaking in high-risk sexual behaviors.
Getting tested annually or whenever you change sex partners is also highly recommended.
That's just so you know your status before engaging in sex with someone else.
It is this type of information that Martin hopes will save lives.
I've watched 50 of my friends die. 20 or 30 of them were in their 20s when they died. Of those people, nobody died pretty. Nobody died nice. If you watch somebody die of AIDS, it is not nice, it is not pretty, it is not fun.
Faven Kay, 23 ABC.